Hello, everyone. Welcome to the 2023 Medicare seminar hosted by myself, Simon Chu. I'm a certified insurance counselor and a financial planner. And thank you once again for attending our webinar. I wanted to introduce our team to you. Many credits to my mom, Christina, who started in the business since 1982. And then to myself that started business since 1989 to present, about 33 years in the business. And now my son, Brandon, has also joined our agency. Been with the agency for a number of years now. We have 4 office locations in the Bay Area: San Francisco, Oakland, Fremont, and San Jose. And I'd also like to introduce our branch office manager, Carmen. She is our Oakland branch office manager. And also Sunny, who is our Fremont branch manager. And myself, along with Brandon, we are managing both San Francisco and San Jose location to serve everybody. And anytime you can feel free to scan our QR code. That's going to bring you right into our website to learn more about our agency. Besides insurance, I also want to introduce on our financial planning awards. These are some of the awards presented by Allianz Life Insurance Company. And each individual awards represent about 10 to 15 million in terms of asset under management that we have assist many of the financial planning clients to position themselves with insurance company. So each one of these award plaques represent 10 to 15 million in production award. Besides financial planning, we also have a lot of awards from insurance companies ranging from Anthem Blue Cross to Health Net to Aetna. These are some just recent awards. Most of the awards within the last 30 years are posted on our website. So I would like to invite you to go onto our website, simon888.com, simon888.com. On the website, you'll be able to see all our insurance company awards from various different insurance companies representing our insurance achievements, as well as the financial planning and life insurance sales achievements. Let's begin. We do not offer every plan available in the area that we'll be discussing today. However, if you'd like to know more information about plans that we didn't get a chance to cover, you can go on to medicare.gov or 1-800-MEDICARE to get more information about your plan options. Let's begin by introducing 2023 news within the Medicare Advantage plan arena. First of all, Aetna plan is coming out with a new select plan. If you're currently an Aetna member, you must process again in order to get a better benefit plan offered by the select plan. Same with Anthem. Anthem came out with a new plan this year called Prime. If you're currently an Anthem member, you must contact us to switch the plan to Prime in order to enjoy a higher benefit level plan. Blue Shield is now getting into Alameda County with a 0 premium plan. Central Health Plan is actually new to the Bay Area from Southern California, and they're actually going to be expanding into Alameda and Contra Costa County for the coming year with a 0 premium plan. WellCare Health Net recently been merged with a name. So it used to be Health Net, now it's merged with WellCare. So it's called WellCare Health Net, also expanded into Alameda, Contra Costa County, and San Mateo County with 0 premium coming up. WellCare and Health Net also has special contract with NEMS. NEMS stands for Northeast Medical Services, and they have locations throughout San Francisco area. If you must use the NEMS network, we will have to assist you in enrolling in a WellCare Health Net plan. Let's introduce a little bit more about why you should be enrolling into a plan. When you have Medicare Part A and Part B, typically A covers hospital services, B covers outpatient services. You need to select a plan to enroll in. Option 1 on the left side is called Medicare Supplement. That basically covers the remaining 20% that Medicare does not cover. And you also need to purchase Part D separately, D for drug. And so this is one option to select from. The other option is on the right side. It's called the Medicare Advantage, also known as Part C, and obviously includes Part D as well. So Part C and D basically includes all of the benefits included in Part A and B. And some plans will also offer additional benefits such as dental, vision, chiropractic, over-the-counter benefits, transportation benefits, so on and so forth. So for each of those plan benefit details, we will cover shortly, as well as you can refer to the plan documents. Once you have Medicare Part A and Part B, remember, you're going to need to enroll in a plan, either the supplemental option plan or the Advantage option. Let's go over the enrollment period. The initial enrollment period is when you first age into 65. You can enroll 3 months prior, the month of your birthday, or 3 months after. This is a very crucial initial enrollment period that you must enroll. Once you pass this time frame, you're not able to enroll unless during the annual election period. That's October 15 to December 7, which will then make your plan effective on January the 1st. Now, there is also an open enrollment period between January 1st to March 31st. This period allows members to kind of test drive their health plan for beginning of the year to see if they like the new plan they enrolled in since January 1st. And for some reason, they choose to disenroll or perhaps change plans, you can still have one last chance for the year. And that's during January 1st to March 31st, the open enrollment period to make the very last change. Once you pass March 31st, you will enter a lock-in period. That's April the 1st to December 31st. During this time frame, you're not able to change any plans whatsoever, except if you qualify for special circumstances. And these special enrollment periods or special circumstances can be the following. If you move from one county to another, you're able to change plans. If you retire from your employer group plan, you're also able to enroll into Medicare plan. Or if you qualify for low income subsidy, you can also make change of your plan middle of the year. Or you have then be diagnosed with a chronic health condition, or you're dual eligible, meaning you have both Medicare and Medi-Cal, also known as Medicaid, then you can also change your plan on a quarterly basis. So these are special circumstances. Please pay attention. If you do qualify or not qualify, please contact us and we'll determine and help you straighten out whether the special circumstances will qualify you for a special enrollment. 2023 Part D coverage stages. Typically on a Part D prescription drug plan, there are 4 stages available. However, when you enroll in a Medicare Part C and D together combined, a lot of times the plan would not have a deductible for you to meet. So the annual deductible for this coming year will be $505. In other words, if you are enrolled in an individual dental plan, most likely some of the dental plans would have a deductible that you need to pay first, and then you start paying the copay. So the initial coverage amount is $4,660, which means if you are picking up prescription drugs less than this total drug cost, you'll be paying copayment up until this level. If you take certain amount of drugs that range from $4,660 to $7,400 during the year, this actually will put you right into the coverage gap, also known as donut hole. During this period, you're going to copay 25% for both brand and generic. And if you take quite a bit of drugs and the total drug cost and your copayment exceeds $7,400 for the year, you will fall into the catastrophic coverage stage. And during this stage, you will be simply paying a lower copayment. For generic, it will be $4.15. For brand, it'll be $10.35 or 5%, whichever is higher. Prescription drug coverage, please pay attention to the following criteria. The first one is pharmacy network. A lot of insurance companies, based on their pharmacy network, range from a preferred pharmacy to standard pharmacy or a mail drug pharmacy. So please pay attention that some insurance company will have a differentiation between pharmacies to identify if it's preferred. Generally, the copayment will be less than a standard pharmacy. And then the second information to share with you is drug formulary. And that means on a insurance company approved list, just to make sure that the drug that you're currently taking are on the formulary list. Otherwise, your drug will not be covered by that insurance company. Tier formulary to identify what level of drugs are you using or what type of drugs. So basically, there are 6 tier. Tier 1 is preferred generic. Tier 2 is generic. Tier 3 is preferred brand. Tier 4 is non-preferred. Tier 5 is specialty. Tier 6 is usually your routine drugs that you take often. And these are typically less expensive drugs for diabetes or cholesterol. And generally, if the insurance company offers tier 6, again, these are going to be very low cost drugs. And some insurance companies may even offer them for no copayment. Last thing I wanted to mention is the late enrollment penalty. So if you are eligible for Medicare Part A or B, you must consider enrolling into a Part D plan. However, it's at your choice. If you don't enroll on time and you enroll later, Medicare will assess a late enrollment penalty, and that's 1% per month, a national average that you did not get enrolled on time. And this late enrollment penalty is actually assessed for the rest of your life. So it's a lifetime penalty. So I encourage you to consult with us as soon as possible that you're eligible for Medicare. We need to make sure that you are enrolled into a drug plan as soon as you're eligible. Now, the following also pertains to the drug benefits. The first one is prior authorization. There are certain drugs that require authorization in advance by providing by your doctors to the insurance company to seek approval, then you can use that drugs. Quantity limits, there are some limitations to how many you can able to prescribe, maybe a 30 days, 60 days, or 90-day supply, and these will be determined by the drug that you are currently using. Step therapy simply means typically when you are treating a medical condition, insurance company may require you to use lower cost drugs first to start off, and then slowly, step by step, increasing the cost of the drugs to a more expensive drug to be used. Transition fill means during transition from one insurance company as you change to another, the new insurance company that pick up your coverage generally are required to offer you the same drug coverage within the first 30 days. And that's what it means. So please pay attention to these criteria within prescription drug benefits. 2023 Plan Star Rating. So these are the Plan Star Ratings reviewed by plan member usage, and they're filed with Medicare. And so Medicare basically will then assign a star rating to each of these plans. Aetna this coming year has 3.5 star and 3-star respectively with 2 different plans. Anthem's 3-star, Alignment Health Plans 4, Blue Shield 3.5, Brand New Day 3-star, Central Health and Essence Healthcare is 3.5 star, and WellCare HealthNet 3-star. Humana and United Healthcare both are 4-star, Imperial 2.5, and CCHP 3-star. So again, these are star ratings comprised of member reviews and surveyed, sent back to Medicare to be able to assign a proper star rating for each insurance company. Let's mention about supplement plan. So as you remember, I mentioned earlier that when you're eligible for Medicare Part A, Part B, on the left side, it's called the Medicare Supplement Plan, also known as PPO type of plan. So the insurance company that we represent are these below listed carriers: Anthem Blue Cross, Blue Shield, AARP, United Healthcare, Aetna, and HealthNet WellCare. So these are the 5 insurance companies that we do offer Medicare supplements available to everyone to consider. If you are eligible for Medicare Part A and Part B prior to January 1st, 2020, you are eligible to enroll into Plan F. However, if you are eligible for Medicare after this date, after January 1st, 2020, then you're no longer eligible for Plan F because Plan F has been discontinued. And the next plan available is called Plan G. The only difference, Plan G has a deductible of $226 per the year. And so all the expenses within a year under $226, you'll be paying out of pocket. And above $226, then the Plan G will be covering in full. And so Plan G, if you're aging into age 65, the monthly rate is $136 a month. And there are a few insurance companies currently offering discount for the first year. Per month discount can range about $25 off per month. Now remember, supplement plan did not include drug coverage, so you will have to purchase Part D separately. There are a number of plans available, range from $4.50 a month to $29, $69 a month, even all the way up to $160. Now it depends on your needs, what type of drugs you need, and also whether the drugs are part of the insurance company's formulary list. We will have to verify the drug benefit for you and help you enroll in the appropriate plan. Let's talk about the second option, which is the Medicare Advantage option. So these type of options typically are the 0 premium plans. So remember, because it's an HMO, you're restricted to use network. So in other words, your primary care, your specialist, your lab, hospital, all must be within a network of providers. And if you leave the network, there is no benefit or it's only emergency benefit coverage. Now remember, enroll into HMO plan, you are required to maintain your Medicare Part A and Part B, and you must continue to pay the Part B premium. If you are retired, typically you are entitled to Social Security retirement income, and the Part B premium typically will be deducted off your Social Security on a monthly basis. And also, depending on the county that you live in, you must enroll into that county specific plan. If you move between counties or out of your current county, then you will definitely have to change plan to your new county of residence on whatever plans available in that new county. And also there are plan selections range from 0 premium all the way to 133, and we will go into details on each county shortly. Let's start with San Francisco County, because we are going to be covering all the counties. If you like to fast forward to the county that you live in and pertaining to that specific county, feel free to do so. We are going to be starting with San Francisco County right now to go over the plan benefits available. We'll start with the 0 premium plans. The HMO Medicare Advantage plans includes Aetna, Anthem, Alignment, Brand New Day, WellCare, Imperial, AARP, United Healthcare, and CCHP. So you can see a number of insurance companies offering 0 premium plans. There are a few that offer a pay premium. And basically, what is the key difference? We basically chose the top 5 options available for San Francisco County for you to consider, because we can't specifically go into all the plans. It will require a lot of time. And also, if you want to go into specific that we're not able to cover at this time, we can definitely spend extra time to counsel you on various different other choices. Now, these are top 5 options available for San Francisco, ranging from Aetna, 0 premium, Anthem, 0 premium, Brand New Day, 0, Alignment, 0, and WellCare Health Net with 0. First benefit we're going to review is office visit. You can see $0 copay for PCP, that's primary care physician, and 0 copay for specialist. So that's what I mean. So for Aetna, it's 0 and 0. Anthem is 0.25, Brand New Day 0.10, Alignment 0.0, WellCare is 5 and 20. Inpatient hospital means when you stay in a hospital overnight, you're required to pay the copay with Aetna plan, $100 a day for 5 days. Anthem is $250 a day for 4 days. Brand New Day, $150 a day for 6 days. Alignment's interesting. The first 4 days actually is free. And then from day 5 to 10, you copay $100 a day. WellCare, basically $275 a day, day 1 to 6. Out-of-pocket maximum stands for, in any given year, the most you ever pay out of pocket for your medical expenses, excluding drugs, is up to this amount. So in other words, once you reach the maximum of $2,500, the plan will cover it in full. So Aetna seems to be at $2,500. Anthem will be at $4,900. Brand New Day $1,500. Alignment $3,000, and WellCare $4,400. Lab and X-ray is pretty straightforward. These are the copays. So many plans basically 0 copay, exception of Anthem. CT MRI 0 copay, with the exception of Anthem being a little bit higher, and then the rest is similar. And then WellCare is up to $275. Over-the-counter catalog basically are your daily needs of vitamins, toothbrush, toothpaste, a bunch of things that the insurance company give to you on a free basis and no prescription needed. And these usage, again, over-the-counter benefits are given to you in a catalog that you can select from. Aetna seems to offer the most at $105 per quarter. And then you can see the other insurance company currently offering a little bit less than Aetna. Gym membership basically belongs to Silver Sneaker Network. Silver Sneaker includes 24-hour fitness. And so with these 3 companies, it's contracted with Silver Sneakers, and you can definitely use 24-hour fitness at your choice. Acupuncture benefits included already with Aetna, 0 copay, and it's unlimited usage versus the other insurance companies, as you can see, some of them with 0 copay, but with visit limits. So how many you can use within a year. In terms of dental added benefits, Aetna offered the highest at $1,500. Basically dental reimbursement, and then vision for eyeglass wear up to $250 reimbursement as well. Medical group wise, Aetna contract with Brown & Tolan, Anthem contract with Brown & Tolan AAMG, Brand New Day contract with AAMG Access, and then Alignment with Brown & Tolan. WellCare is with Brown & Tolan, and NEMS, Northeast Medical Services. So if you are in need of enrolling into Northeast Medical Services within San Francisco, and we will be assisting you enrolling into the WellCare plan, because this is the only plan that at this moment NEMS is contracted with. So anyway, sum it up, in San Francisco, these are the top 5 choices for this coming year. And so for your consideration, these are the plan highlights, and you can consider probably real obvious to see which plan currently offer the best benefit. Now we're going to move into Alameda County. Alameda County have numbers of 0 premium plans, including Aetna, Anthem, Alignment, Brand New Day Central Health, Blue Shield, Health Net WellCare, Essence, also known previously as Stanford Health, AARP United Healthcare. You can see that Central Health is actually the first time coming into Alameda County, offering a 0 premium plan. Because there's so many plans available in Alameda County, just like San Francisco, we can only handpick the top 5 selections to highlight right here, which includes the Aetna HMO plan. There's an Aetna PPO plan as well, and then Central Health, Brand New Day, as well as Blue Shield. So these are the 5 top choices within Alameda County for most of our clients who are enrolled into. And so really straightforward office visit. You can see the copay for primary care versus specialist. Pretty much it's quite straightforward with these 2 companies, Aetna and Central Health, both at 0.0 versus Brand New Day 0.10, 0.15. Hospital copay, $250 a day for first 7 days. And then Central Health, basically it's free. So when you go to hospital, 0 copay. Brand New Day, it's $150 a day for day 1 to 6. And the Blue Shield is $250 a day for day 1 to 5. The maximum out of pocket with Aetna is $3,900. Central Health is $899. Brand new day is 1,500, and Blue Shield is 4,400. Lab and X-ray is pretty self-explanatory, straightforward here. CT, MRI, you can see as well, all the plans are similar with the exception of these three that have copay. Out of basically over-the-counter catalog, 105 per quarter offered by Aetna, and then actually Central Health offered the most at 325 per quarter flex spending. Actually, there's a lot more involved with their benefit, but over-the-counter, we can go into specific when we talk about the plan enrollment with you shortly. Gym membership, all the plans contract with Silver Sneaker. So again, you can use Ghost Gym, 24-hour fitness throughout the Bay Area, throughout your county as well, with all of these plans within Alameda County. In terms of acupuncture benefits, zero copay, unlimited with Aetna, and then dental with $1,500 benefits, and the vision for glassware at $250 benefits. So pretty much this is one of the highest benefits within Alameda County, together with Central Health, which also includes acupuncture benefit and no copay, unlimited usage as well. Dental's included, and then vision's up to $300 for eyeglassware. So these two seem to stand out in terms of these three benefits that I just mentioned. In terms of medical group, Aetna is contract with Brown & Tolman. And so Brown & Tolman is one of the larger medical groups for San Francisco, as well as for East Bay. And the Hill Physician Medical Group is contracted with Central Health, together with Brand New Day, also with Brown & Tolman Hill Physician, and then same with Blue Shield, Brown & Tolman and Hill Physician. These are the top 5 choices within Alameda County that typically our clients tend to select from. And so we did the highlight comparison just to show these 5. If you want to see other plans available in Alameda County that we have not described here on this page, no worries. We can definitely go over them with you specifically. Now we're going to start with Contra Costa County Medicare Advantage plans. These are the plan options available. Central Health with 0 premium, Brand New Day, $55 a month, WellCare Health Net 0 premium, Humana 68, AARP United Healthcare have 2 plans available, both with a premium. Now we also selected the top 5 to list here to showcase the comparison. So you can see that Central Health is a 0 premium plan versus Brand New Day at 55, WellCare 0. So these 3 probably are the top choices within Contra Costa County for many of our clients. And you can see the copayment for primary care versus specialist. Central Health tend to be 0, 0, 0, 10, and 0, 20 with these 3 carriers. Hospitalization, $0 copay per day. So in other words, for Central Health, you don't have to pay anything when you go in the hospital. Brand New Day is $250 per day for the first 5 days. WellCare is $375 a day for the first 5 days. Maximum out-of-pocket Central Health is $899. Brand New Day is $299, and then WellCare is $5,500. The lab, pretty much all the companies are saying these 3 companies are the same. No copay. CT, MRI, no copay for Central Health. Perhaps up to $200 for Brand New Day, up to $200 for WellCare. Over-the-counter benefits seems to be standing out. It's the Central Health. They offer $325 per quarter, more than Brand New Day, as well as more than WellCare. Gym membership, these 2 belong to Silver Sneaker, which means you can use 24-hour fitness. WellCare use Peer Fit. It's a different program, as well as Renew Active is a different program as well. We can go into specifics when we talk about these plans. In terms of acupuncture usage, Central Health do include with 0 copay, dental benefits included, vision $300. Brand New Day, basically acupuncture, you don't have to pay copay and basically only cover 30 visits. Dental benefits included with Delta Dental, and then vision can also use up to $300. You can see the benefits quite stand out with these 2 plans in terms of these 2 benefits. Medical group, Central Health is contracted a Hill Physician. Brand New Day is both with Hill and John Muir. WellCare is with Hill, and then AARP United Health with Canopy Hill, and then Humana is with Sutter, Hill, and John Muir. So we do have some clients in Contra Costa County not only use Hill Physician Medical Group, which all these plans will be able to do fine. And also they are in particular to use the John Muir Medical Groups. There's only 2 plans available in Contra Costa County that use the John Muir Medical Group. So we can definitely help you to sort out if you see specific physicians and providers, which plan they participate in. So once again, to sum up Contra Costa County, we highlighted the 5 plans that include Central Health, 0 premium, Brand New Day, WellCare, AARP, Humana. So you can see clearly that which plan suits you well, as well as you can see very clearly that which plan offer, one of the best benefits available in Contra Costa County. Now we move into San Mateo County. San Mateo County have quite a bit of 0 premium plans, including Anthem, Blue Shield, Brand New Day, Central Health, WellCare, and AARP United Healthcare. Again, we picked the top 5 companies to compare for San Mateo County, specifically Central Health, Brand New Day, Anthem, Blue Shield, and WellCare. All 5 plans that compare are 0 premium. You don't have to pay anything on a monthly basis to have these plans be enrolled. So again, for San Mateo County, first benefit we're going to go into is office visit, 0 copay for primary care, $5 copay for specialists. So 010, 025, 015, 015. Hospitalization for Central Health, $100 a day for the first 5 days. Brand New Day, $150 for first 6 days. Anthem, $250 for first 5 days. Blue Shield is the same. And then WellCare is $200 a day for 5 days. The maximum out of pocket with Central Health is $999. Seems to be one of the lowest. The second lowest out of pocket is Brand New Day, $1,500. So basically, these two quite stand out in terms of the benefit for you to have a lower out of pocket as compared to all the other plans listed right here as comparison. Now, in terms of lab and X-ray, both of these plans are 0 up versus Anthem is the only one that requires a $10 copay. Blue Shield and WellCare also 0 copay. CT MRI, most of the plan pays from 0 to 50. These two are the same. And then you can see the copays for the others. Over-the-counter benefit, $300 per quarter seems to be the highest with Central Health. And then Brand New Day offers 40. And then Anthem is 50. Blue Shield is 100. And then WellCare is 78. Gym membership, you can see almost all 4 companies offer through Silver Sneaker. That means allowing you to use 24-hour fitness to ghost gyms. So any one of these facilities will do in your area. And then in terms of acupuncture benefit, $0 copay, unlimited with Central Health. The dental benefits already included, as well as vision benefit up to $300. Brand New Day offers 12 visits for acupuncture. The dental included for Delta Dental, vision benefit up to $300. So you can see in terms of acupuncture, dental, and vision, these 2 plans shares quite high benefits versus the other 3. In terms of medical group contracted, Central Health is contracted with a health physician, Access Medical Group. Brand New Day is with AAMG and Access. And then Anthem is with Brown Tolan and AAMG. And then Blue Shield is with Brown Tolan Health Physician and Palo Alto Medical Foundation. This is very important because a lot of clients in the peninsula like to use PAMP network, and Blue Shield is the only one that's contracted with PAMP for San Mateo County. So once again, these are the highlights for San Mateo County plan selection. Top 5 selections here listed for comparison purpose. You want to see specific details, we can definitely talk more about the plan selections. Next, we're going to talk about Santa Clara County plan selections. There are quite a bit of 0 premium plan. So it includes Aetna, Alignment, Anthem, Blue Shield, Brand New Day, Central Health, WellCare, and Essence, along with AARP. Actually, all these plans include 0 premium, as you can see. And then the last 2 actually have a number of other choices, which allows you to pay premium as well. Now, because there are so many plans to compare, we can't possibly list every single one of them. So again, we picked the top 5 to select to share with you. First one is Aetna. Second is Anthem, Alignment, Brand New Day, and Central Health. So you can see, again, office visit in terms of copay for primary care and specialists. You can see that almost every plan is similar with the exception to Brand New Day, that 0 copay and a $10 copay for specialists. Inpatient hospital, $175 a day for the first 4 days, $95 a day first 5 days. Alignment, the first 4 days is 0 copay, and then from 5 to 10 is $100 copay. Brand New Day is $150 a day for the first 6 days. Central Health, you actually don't have to pay anything when you go to hospital. 0 copay any day. So basically, Central Health, in terms of hospital benefit, it looks to be greatest benefit here. The maximum out-of-pocket is $899. So this also is the lowest out-of-pocket maximum in terms of this comparison among the 5 carriers. Lab and X-ray, as you can see, every company is 0, 0, 0 out. So you don't have to pay any copay. CT MRI, most of them are 0, with the exception to Brand New Day, possibly 0 to 50. Over-the-counter benefit, you can see that 105, it's one of the highest with Aetna. And then this, actually the highest with Central Health at $325 per quarter flex spending. And for gym membership, you can see that 4 of these carriers are contracted with Silver Sneaker, which allow you to use the 24-hour fitness or ghost gym. And then for acupuncture benefits, Central Health and Aetna seems to be offering unlimited, 0 copay. Dental benefit, $1,000 available with Aetna. This seems to be the highest, and then vision at $200. And then vision with Brand New Day and Central Health are at $300. So I just basically point out the key differences among the plans. And in terms of medical group selection, Aetna is contracted with Santa Clara County IPA, SCIPA. Anthem is with PMG, Physician Medical Group San Jose, with Care More Medical. And then Alignment is PMG is SCIPA. Brand New Day is both. So again, Central Health is also with SCIPA and PMG San Jose. So in terms of PMG along with SCIPA, these two are one of the biggest medical group available in Santa Clara County, and most likely that your physician will participate in these medical group as well. So again, these are the top 5 choices within Santa Clara County. And so for Santa Clara County, if you don't see the plan highlighted here, that's okay, because there are so many to select from. We can go into specifics of your need and which plan may be more suitable for you. We're more than welcome to review every single plan available in Santa Clara County with you. So once again, this is simple highlight among the top 5 selections available for comparison. This Medicare plan comparison is basically a highlight of benefits. So for plan-specific coverage, refer to each insurance company's summary of benefits, because in the summary of benefits, it will go into detail what is covered and how much copays and all specific details in the summary of benefits. Or you can also go into Medicaid.gov or call 1-800-Medicare to get additional information on your plan options. Obviously, we feel free to contact our agency as well to seek additional assistance with plan selection. We will be more than happy to schedule an appointment in the office. We can schedule a Zoom call as well as meet with you in person in our office. Besides that, I wanted to talk a little bit about financial planning. If you wanted to consult with us on rolling over your 401k, IRA, 403b, TSP, or simply have cash or brokerage account you want to invest, there are a lot of annuity options available, ranging with 20% bonus to 35% bonus currently. These are the current promotions that I highly recommend you to consult with us to learn more. You can simply also scan our QR code to get into our website to learn more about what we have to offer. Now, besides that, we also have a tax-free bank matching leverage available for retirement tax-free income planning. But this plan is only available for individuals under age of 65. So if you have friends and relatives or perhaps your children who may be qualified or who are thinking of planning for their retirement to have leverage tax-free income, please definitely click onto our QR code, visit our website to learn more about the program and see if that would be a good fit for their overall retirement income planning. Let's stay connected. If you're on Facebook, please click into our page, Simon AAA, simply click like. So if we have any publications going in the future, you will be getting notification right away on Facebook. Also, if you go into YouTube, look up our channel, Simon AAA, click on subscribe. You'll be able to also receive notification once we post a video. You'll get notification that can watch immediately. Feel free to visit our website, simonAAA.com, to learn more about our insurance offering as well as financial planning and investing offering. Also contact our office if you have any questions, 888-746-6688. And these are other options available if you watch Chinese television. I'm on TV 26, first and third weekend every single month at 7:30 p.m. I'm featured here on the show with host Lily Cholo, and she is the host for the TV station, TV show with Bay Area Finance with Lily. And I'm also featured on the Chinese radio. If you happen to be on Singtao AM 1400 radio, as well as Sound of Hope FM 96.1 radio, you'll also be able to hear my introduction on insurance and financial planning, obviously in Cantonese as well as in Mandarin. And feel free to click our QR code once again to visit our website. We have 4 offices to serve you: San Francisco, Oakland, Fremont, and San Jose. We look forward to meeting with you as well as help you enroll and select the right plan for this upcoming year. And we look forward to meeting you and wishing you the very best. Thank you very much for watching our webinar, and we will look forward to help you enroll into the right plan with the best benefit for the upcoming year. Thank you.